before I enter my patient's room, I'm going to check the electronic health record for any new lab values, new orders, or any previous orders that I need to know about. And then I'm going to check the door for any flags, signs, things like NPO, fall risk that I need to know before I enter the room. So I'm going to go hand hygiene. Hi,
Hey.
my name's Lizzie. I'm going to be your nurse today.
Okay.
Can you tell me your name and date of birth?
Alexa Delzer, May 8th, 2006.
Okay, Alexa Delder, May 8th, 2006. Perfect, that matches up. So can you tell me why you came in today?
I'm having some knee pain in like my left knee.
Your left knee?
Yeah.
Okay. And what were you doing when you got this pain?
I was like walking on the treadmill and I feel like I stepped a weird way and like my knee kind of moved a weird way. It was really weird.
Okay. Can you point to exactly where
Yeah.
you're feeling that?
I feel like it's right underneath my knee.
Right under there.
Yeah.
Okay. And can you describe this pain for me? Is it sharp, shooting?
I feel like it's sharp and shooting, yeah. It just
Okay.
like really hurts like if I take like a different step on it that's not normal, yeah.
Okay. Does anything make it feel worse?
Just like walking like long distances makes it worse, yeah.
Does anything make it feel better?
Resting really helps and like ice sometimes helps, but yeah.
Okay. And when did this start for you?
I would say it started like a week and a half ago,
Okay,
yeah.
And then if you had to rate it, 0 being good, 10 being the worst pain you've ever felt, what would you rate it?
I would rate it like a 6.
A 6, okay.
Yeah.
Well, I'm sorry you're having pain, but we'll try to see how we can minimize that, okay?
Yeah, okay.
Okay, so I'm just going to start out by taking some vitals on you.
Okay.
So I'll start with your temperature. I'm going to redo that one. Okay, 98.4, that's a good temperature. I took that temporally. And I'm going to do a pulse ox now. This just sees what your oxygen saturation is.
Okay.
Okay, 99, that is great. Now I'm going to listen to your apical pulse.
Okay.
This will just tell me what your heart rate is.
Okay.
So just try to breathe like normal. Okay, this will take about a minute.
Okay.
Okay, perfect. So that heart rate for 1 minute was 82 beats per minute, so that's great. Great rhythm, great rate. And I also listened to your respirations, and I got 18, so that's great. I listened for 30 seconds, and I multiplied that number by 2 to get that. And those were unlabored, so that's great. It means you don't have to work a lot to breathe. So now I'll just take your blood pressure. So I'm gonna measure it to your arm first. Okay, good fit. I'm gonna put it on here. It's gotta be pretty tight. Does that feel good?
Yeah, that feels good.
Okay. So I'm gonna start out by estimating your systolic blood pressure,
Okay.
and it'll tell me kind of where to start.
Okay.
Okay. So I'm gonna feel that brachial artery. I'm gonna pump it up. You can just relax. Okay, I felt it around 120, so I'm gonna pump it up to 150 when I'm doing your blood pressure.
Okay, yeah.
So just let all the pressure out, and then just relax your arm as much as you can. I got 122 over 90, so it's a good blood pressure. Take this cuff off right there. Okay. And then, Alexa, can you tell me what my name was?
Lizzie.
Lizzie, yep. And then can you tell me where you are?
In the hospital.
The hospital. And can you tell me the date today?
December 11, 2025.
Perfect. Okay. So my patient is fully alert and orientated, so that's great. If you weren't, I would perform the Glasgow Coma scale on you. But you're okay, so we're good. So I'm gonna just test your pupils. So I'm gonna measure them first. Okay, I'd say they're about a 5. Yeah, 5 bilaterally. So now just look at me and I'm gonna test your pupil. Okay. Perfect. So your pupils are equal, responsive, and reactive to light. So that's great. I can tell by your facial expressions that you're relaxed. You have the ability to swallow. I don't see any facial drooping. Okay, your skin color looks pale pinkish color. Check your legs. It looks great to me. You have good body alignment. I don't notice any foul odor or anything, so you have good personal hygiene. That's great. And I know that you're able to articulate well. You have clear speech. You're able to hear because you're responding back to me having a conversation. So that's all great. I'm gonna test your muscle strength now.
Okay.
So I'm gonna have you squeeze my hands. Okay, I'll have you pull, push. Now I'm gonna test your feet. Can I have you take your socks off, please?
Yeah.
Perfect. Okay. Have you pull, push. Can you lift your legs off the bed? Perfect. So that's good muscles. And then can you wiggle your fingers? Okay, and toes. Do you notice any tingling or numbness when you do that?
No, I don't.
Okay, perfect. So I'm gonna move on. I'm gonna listen to your lungs, but first, if you had like a nasal cannula, oxygen mask, anything like that, I would check the flow rate, and make sure it was fitted properly, everything like that, but you don't have that, so that's okay. And do you have a cough?
I do not know.
Okay, if you had a cough, I would ask frequency, quality of that cough, if you had mucus, what it looked like, how much mucus you were having.
Okay, yeah.
So I'm gonna auscultate your anterior chest.
Yeah.
So I'm gonna do 6 spots. Okay. So just try to take a deep breath every time I move my stethoscope.
Okay, yeah.
Perfect. And then I need to do your back, so if you want to kind of turn towards me,
Yeah.
if that's okay. Okay. If you want to move your hair out of the way too. Okay, just keep taking those deep breaths. Okay, I'm gonna go under here a little bit.
Okay.
Okay, perfect, Miss Delzer. So, lungs sounded great. No adventitious sounds like crackles or wheezes or anything like that.
Okay.
So nothing to note there. And then if you had an order for an incentive spirometer or deep breathing, I would educate you on how to use those and kind of the importance of deep breathing. But you don't have one, so we're all good. And now I'm going to do your cardiac assessment. So I'm going to listen in 6 places, okay? So I'm going to start with the diaphragm, aortic, pulmonic, Erb's point. Okay, I'm going to go over here, tricuspid, mitral. Okay, so great sounds, great rhythm, right? And then I didn't notice any murmurs or anything of concern. And I heard your S1 loudest at your apex and your S2 loudest at your base. So that's great. Now I'm going to test your capillary refills. So if you just want to put your fingers out. Okay. Hold these down. Okay, fingers look great, all less than 3 seconds. And then I'll do your toes. Those are good too, all less than 3 seconds. And then while I'm down here, I'm gonna check for any swelling on your legs and your feet as well. Any edema. Okay, no edema on your legs, that's great. I'm gonna listen to your pulses now, okay? So first your dorsalis pedis. Okay, 2+ equal bilaterally, that's great. Okay, now I'm gonna listen back here, your posterior tibial. Okay, 2+ bilaterally as well, that's great. Now I'm gonna listen to your radial pulse. Okay, 2+ bilaterally, that's great. Okay, pulses all looked good. If you had any IVs or anything like that, I would check the flow rate, the type of IV you have, if you had any like redness around these sites, swelling, anything like that, but you don't have one, so we're all good. And then if you had any SCDs, those go on your legs, foot pumps, TED hose, anything like that, I would make sure they're hooked up, fitted properly, stuff like that. And those are just to help with deep vein thrombosis, so if you were immobile, but you don't have those, so we're all good. We can move on to skin now. So I note, looking at your skin, I'll just pull this down. No lesions, wounds, anything like that. IVs were all good. You have good skin integrity. So I'm gonna test your skin turgor. Okay, and it returns back to normal, so that's great. I'm gonna do your temperature, so I'm gonna pull this down so I can do your legs too. Okay. Okay. Feels great. You're warm bilaterally, equally. Yeah, great overall skin. So if you were at a risk for skin breakdown, I would perform the Braden scale, but I don't see that at all, and you're able to move around, so that is great. Yeah, so your skin is great. If you had any wounds, I would check all of that, stuff like that. So now I'm going to move on. So I'm gonna have you lay flat if you can. Okay, now I'm gonna kind of pull this down if that's okay.
Okay.
Okay. I'm just gonna inspect your abdomen. It looks flat. Flat contour looks great. I don't notice any ostomies or anything that needs to be checked. If there was like a Foley or anything like that, I would check that, of course. But your stomach looks good. So now I'm gonna auscultate your bowels. I'm gonna start in the right lower quadrant and I'm gonna move clockwise. Okay, perfect. So I heard bowel sounds in all 4 quadrants, so that's great. It means everything's working good. I'm gonna palpate your stomach now. I'm gonna move in circular motions, and I'm just checking for any firmness, distension, anything like that. Okay, no masses or anything like that. Did you feel any tenderness when I did that?
No, I didn't.
Okay, and then Miss Delzer, are you nauseous at all?
I'm not, no.
Okay, and then in regards to your current diet, how do you feel you're tolerating it?
I feel like I have a pretty good diet. I feel like I'm trying to eat healthy and all that, so.
Perfect, okay. And with bowel movements, when was your last one?
This morning.
This morning, okay. And how frequently are you having bowel movements?
I would say like every day.
Every day,
Mhm.
okay. And what color are they usually?
Like a brown.
Brown, okay. So I have the Bristol stool chart here. Can you say
Yeah.
what type you have?
I would say like a type 4.
Type 4, okay, that's normal, that's good. Sounds good. So kind of along with your bowels, can you tell me how regularly you urinate?
I would say about 5 to 6 times a day.
Okay, and I notice you have no Foley's or anything like that, so we don't need to check those. And then, so you said 4 to 5 times a day you urinate? Okay. And what color is your urine?
I would say like light yellow, sometimes clear.
Okay, good. And do you ever have cloudy urine?
Mm-mm.
Do you ever have pain when urinating
No.
or a foul odor?
No.
Okay, so we can rule out signs and symptoms of a urinary tract infection, so that's great. If you were having urinary retention, I would do a bladder scan on you, but that's not necessary, so we can move on. And then with activity, how well do you tolerate activity?
I feel like I'm able to move around well. Like I try and exercise. Yeah, I feel like I'm able to move around pretty well.
You're able to walk fine, no
Yeah.
assistive devices, wheelchairs?
No, I don't use anything like that.
Okay, perfect. So I'm gonna do the Morse scale on you. It's just gonna assess you for a fall risk. So even though you're conscious and stuff like this, things, different medications, level of consciousness, history of falls, anything like that can contribute to that.
Mhm.
So we would just do that to assess you. You do that every shift. It's just normal. And yeah, do you have any questions or do you need anything?
No, I don't have any questions.
Okay, so I'll give you your call light right here. Are you comfortable in bed?
Yeah, I'm pretty comfortable.
Okay, perfect. And with the call light, just press it if you need me and I'll come in here for anything. I'm gonna check that the bed is locked, perfect, and the side rails are up. Okay, well thank you for your cooperation. You have a good day.
Thank you.
Thank you. And then I do hand hygiene.